friends, let's talk about infertility. But before going into that, there is a saying or a quote from Hippocrates which states that it is more important to know what sort of person has a disease than to know what sort of disease a person has. Now coming back to infertility treatment has three aspects. Number one is physiological aspect, number two is pathological aspect, and the last one, number three, is psychological aspect. Out of these three aspects, the most ignored part is psychological aspect. Emotional stresses can inhibit menstruation and your ability to conceive. Psychological factors in infertility relates to liver, kidney, spleen, heart and lungs also. In infertility treatment, emotional factors plays role to that extent that it makes treatment and medication ineffective. So in order to make treatment and medication effective, you have to focus your attention on your emotional factors. The liver plays important role in female reproduction and menstruation. When there is stagnation of liver energy, it may relate to general depression, frustration and suppressed anger, or more specifically to resentment of femininity and resistance to the physiological and psychological changes of adult sexuality. The kidney organ is related to fear. For many women, the major developmental stages of puberty, pregnancy, childbirth and motherhood are surrounded by fear. The fear of the unknown, fear of pain, fear of death, fear of responsibility, fear of failure. This can cause stagnation of energy just as much as anger and frustration. Lungs are one of the organs that are affected by your emotions. Closely related to the fear of the unknown are grief and the fear of loss. Holding on to the past, trying to stop time and unwillingness to let go of old relationships and fully participate in new ones are associated with stagnant lung energy. Then comes the heart. There may be an unwillingness to participate in any relationships at all, with an attempt to block the flow of love, life and sexuality, as in anorexia nervosa with amenorrhea, or in some cases of infertility, there may be stresses and fluctuating affections within the relationship with mixed feelings about conception. It seems that these mixed emotions and mixed motivations can prevent conception, which then only occurs when the desire to conceive becomes dominant. The last organ is spleen. If there was not a solid, warm, caring relationship between the woman and her own mother, the woman may feel a great lack and emptiness within, a feeling of rejection and lack of support, and may withdraw into anorexia or subconsciously or consciously avoid motherhood herself. She may feel that she has nothing to give a child, especially if it is a daughter. Acupuncture not only treats the physiology and pathology behind infertility, it has the power to process your emotions and treat psychological factors behind your infertility. Acupuncture helps you keep calm, peaceful and stress-free, increasing your chances of getting pregnant.